Hello friends, let us now learn some important points about the diuretics which in antihypertensive drugs. So diuretics, these diuretics will mainly cause loss of sodium and water, and they decrease the blood volume and they decrease the cardiac output and also increase the blood pressure. So if you see the first, these diuretics are most commonly preferred in hypertension, and the most commonly preferred diuretics in hypertension is thiazide diuretics. The first important diuretic is we have osmotic diuretics. So in the diuretics, first we have osmotic diuretics. The first osmotic diuretics are mannitol. Mannitol is the drug which should be filtered freely. Mannitol is an osmotic diuretic. It should be filtered freely. It should not be reabsorbed. It should have osmotic effect. So the site is the mannitol acts on all the sites in proximal convoluted tubule and loop of Henle, but the major action is present in loop of Henle. So what happens if we give IV mannitol? On giving IV mannitol, this will increase the osmotic pressure of the blood vessels. This will increase the osmotic pressure in blood vessels and thus causes removal of excess fluid from the cells. All the excess fluid gets removed from the cells, and this leads to expansion of extracellular fluid. Whenever there is removal, see, this is the cells. From the cells, because of the increased osmotic pressure from the blood vessels, there is removal of excess of fluid from the cells, and thus there is expansion of extracellular fluid. So both these expansion of extracellular fluid causes increased renal blood flow. Whenever there is increased renal blood flow, it causes increased glomerular filtration rate. Mannitol is freely filtered at the glomerulus. Because mannitol is freely filtered at the glomerulus, it easily reaches the proximal convoluted tubule. So this is the proximal convoluted tubule and distal convoluted tubule. So this mannitol, once it is freely reaches the proximal convoluted tubule and loop of Henle. Now once it had reached the proximal convoluted tubule and loop of Henle, normally there is reabsorption of sodium and water occurring from proximal convoluted tubule and loop of Henle, but this mannitol will inhibit the reabsorption of the solutes in the from the ascending limb of loop of Henle. So there is no reabsorption of sodium and water. Similarly, it also inhibits the reabsorption of water from the descending limb of loop of Henle. All these are because the mannitol increases the osmotic pressure in the tubules, and thus it prevents the reabsorption of solutes and water from ascending limb of loop of Henle and inhibits the reabsorption of water from the descending limb of loop of Henle. So overall, if you see, there is loss of solutes and water in the blood, right? So this reabsorption is not occurring, so as a result there is loss of solutes and water from the collecting tubule to the outside in urine. Then the uses of the mannitol, if you see, this is used as IV for the treatment of glaucoma, because in glaucoma it decreases the intraocular pressure, and it is also used in cerebral edema where it decreases the intracranial pressure. This is also used to maintain the glomerular filtration rate in impending renal failure. It is used to maintain the glomerular filtration rate in impending renal failure. Then it is also contraindicated in acute renal failure, because this will increase the extracellular fluid volume. Then it is also contraindicated in cerebral hemorrhage, because this mannitol will worsen the cerebral hemorrhage, right? So this is about the osmotic diuretics, mannitol. One more important point about mannitol is, if we have the oral mannitol, this causes osmotic diarrhea, and we have other osmotic diuretics are also present, like isosorbide and glycerol. These isosorbide and glycerol are used orally, and these are used in the treatment of glaucoma and cerebral edema. So these are the important points about osmotic diuretics. Then if you see, thank you guys for watching my lecture. Thank you.